Have you ever felt like you're drowning at work? As a PCU nurse myself, I know that feeling all too well. The hospital keeps adding patients, but our resources and support stay stagnant. A 4:1 nurse-to-patient ratio can be brutal when you factor in the patients are coming to the hospital with more comorbidities. You're juggling meds, monitoring drips, advocating for your patients, and on top of that, you still have to chart on all your nursing care because, as we all know, if you didn't chart it, you didn't do it. And what happens when they take away your CNA? We often end up being the ones providing personal care for our patients. By the end of that 12-hour shift, my brain feels like mush and my body is completely drained. You feel like you can't catch up, but here's the surprising lifeline I threw myself: exercise. It might sound crazy, but hear me out, because even in the chaos of the unit, I discovered that getting my body moving was the key to overcoming burnout and actually feeling energized again. Let me show you how exercise can be your secret weapon against stress too. Long hours, heavy patient loads, and emotional strain. That's the reality for many nurses, leading to a serious issue called burnout. Burnout zaps energy, increases cynicism, and impacts the quality of care nurses can provide. You witness the joy of recovery, the heartbreak of loss, and everything in between. This constant demand can make you feel depleted, cynical, and question your passion for nursing. Burnout doesn't just impact you. Studies show it affects the quality of care you provide to patients, potentially leading to medical errors, patient dissatisfaction, and even nurse turnover. But there's a powerful weapon against it: exercise. Studies show physical activity is a natural stress reliever, boosting mood and reducing anxiety. It also improves sleep, crucial for us shift workers, and increases overall energy levels. By incorporating exercise, even in short bursts, I feel more resilient and better equipped to handle the demands of my job. Exercise is my self-care, because I realize that as a healthy nurse, I am a better nurse for my patients and myself. Burnout feels relentless, but here's the good news. Science backs exercise as a powerful tool for nurses. Studies show it's a natural stress reliever. When we exercise, our bodies release endorphins, those feel-good chemicals that improve our mood and reduce anxiety. But it doesn't stop there. Research from the American College of Sports Medicine, ACSM, suggests that regular exercise can significantly improve sleep quality. A good night's sleep makes a world of difference in our energy levels and overall well-being. Perhaps the most significant benefit is the boost in resilience. Exercise strengthens our bodies, but it also strengthens our minds. A study published in the Journal of Nursing Research found that nurses who participated in regular physical activity reported feeling more capable of handling the demands of their jobs and maintaining a positive outlook. These studies highlight the multiple facets of exercise benefits. It doesn't just improve physical fitness, it helps us manage stress hormones, sleep better, and feel more equipped to handle challenging situations. So the science is clear. Exercise can be a game changer for nurses facing burnout. I know it has for me. It reduces stress, improves sleep, and increases resilience. Let's explore practical tips on how to fit exercise into your busy schedule, even with those long shifts. All right, we know exercise is a powerful weapon against burnout, but let's face it, fitting it into your already packed schedule can feel like another impossible task. Don't worry, I've got your back. Here are some practical tips specifically designed for busy nurses. Embrace short workouts. Forget the hour-long gym sessions. If you have time and the energy, go for it. But studies show that even short bursts of activity can make a big difference. try a 15-minute HIIT routine at home before work. I would say during a break, but we all know that most of the time we don't even have time for a bathroom break, let alone 15 minutes for a short burst. There are tons of free workout videos online, making it convenient and accessible. No fancy equipment needed. Bodyweight exercises like squats, lunges, and push-ups are fantastic ways to get your heart rate up and your blood pumping. Sneak in stretches. Here's a secret weapon. Quick stretches throughout your shift. Tight muscles can contribute to fatigue and stress. A few minutes spent stretching your back, neck, and shoulders can make a world of difference. Don't underestimate the power of these small movements. They improve flexibility, reduce muscle tension, and give you a much-needed energy boost. Find your workout buddy. Let's face it, accountability matters. Partner up with a colleague for motivation and support. Knowing someone else is relying on you to show up can make all the difference in sticking to your exercise routine. It can be a fun way to de-stress and connect with your colleagues outside of work. Plus, having a workout buddy can make exercise more enjoyable and keep you on track during those busy weeks. Remember, consistency is key. Don't be discouraged if you can't fit in a workout every single day. Aim for consistency, even if it's just a few short bursts of activity throughout the week. Every bit counts. Focus on finding activities you enjoy. Explore different options like dancing, swimming, or yoga. When exercise feels fun, you're more likely to stick with it in the long run. For me, it's dancing. I've joined a Zumba class, and when I can't participate, I use YouTube to find a video to move at home. Alright, let's talk motivation. Exercise is about feeling good and being able to perform your best. Think about how it can help you be a more patient, focused, and resilient nurse for your patients and yourself. Taking care of yourself isn't selfish, it's essential. When you prioritize your well-being, you become a better nurse, a better colleague, and a happier person overall. So, lace up your shoes, find your workout buddy, and get moving. Your body and mind will thank you for it. You're not alone in this fight against burnout. Many nurses, myself included, have discovered the transformative power of exercise. For me, it became more than just physical activity. It became an escape, a chance to clear my head and come back to work feeling refreshed and ready to face whatever came my way. Before I embraced exercise, those long hours in the PCU felt suffocating. The constant pressure, the emotional toll, it all began to drain my passion for nursing. But then I started incorporating short workouts into my routine, dancing, yoga, Pilates, or even if it was just a 15-minute HIIT session before work. That burst of activity became a lifeline. It allowed me to process the challenges of the day, clear my mind of stress, and return to work with a renewed sense of focus and energy. Believe me, the difference is remarkable. I found myself more patient with my colleagues, more empathetic with my patients, and overall, just happier in my role as a nurse. This is just my story, but it serves as a testament to the power of exercise. Whether it's a quick workout, a relaxing yoga session, or finding a workout buddy, there's a way to incorporate exercise that works for you. Remember, taking care of yourself isn't selfish, it's essential. When you prioritize your well-being, you become a better nurse, a better colleague, and a happier person overall. So, take the first step towards a healthier, happier you. Lace up your shoes, find your workout style, and get moving. Your body and mind will thank you for it. You're not powerless against burnout. Take control of your well-being today. Share your experiences with burnout in the comments below. Let's create a supportive community of nurses who can lift each other up. And don't forget to try out the exercise tips I shared. Short workouts, stretching at work, finding a workout buddy, there are ways to fit exercise into even the busiest schedule. Remember, small changes can make a big difference. Prioritizing your well-being, it's essential for being a fantastic nurse and a happier person overall. Looking for more self-care strategies for healthcare professionals? Subscribe to this channel